a good way for you to be able to use your telehealth programs. And if you don't have one, you need to create one. But let's say you already have one, what you want to do in addition to this is to create a CHF COPD telehealth program in which you're going to be marketing this to physicians, referral social workers, and discharge planners out there. You're going to let them be aware that you have a protocol that if a patient has CHF, has COPD, and they continuously going back to the hospital, or they're very brittle, or they are at high risk of readmissions upon assessments because they're going back and forth, you want to be able that they are given a telehealth monitor. By you providing this, you are going to likely reduce the chances of them being readmitted back to the hospital. Why? Because you can properly manage and monitor them continuously. Now, if you have this program, there are several things that you need to make sure you have and promote it. Create videos showing what services are offered, or create live demonstrations to physicians. Create brochures specifically targeting these physicians and social workers talking about how beneficial telehealth can be for patients with CHF. Now, in addition to that, there are several challenges that you may have in regards to adding a telehealth program to your company, especially dealing with patients with CHF. You want to be able to carefully screen them. Understand that patients must be and should be mentally and physically able to monitor their own conditions. Okay, you want them to be able to bring in the right types of nurses to bring in there who are willing and able to be able to train and teach the patients and their families on what they need to do in order to be able to how to use these programs and these products. You want to be able to make sure you create a protocols that can be followed clearly by the patient and by your staff. And at the same time is make sure you properly monitor these results. Don't wait 24 hours to find out what the results are that are showing up on a daily basis. Somebody should always be checking continuously the monitors or hire a separate company that can monitor the results of the patient's vitals, especially the weight that they're actually having. Remember, telehealth and telemonitoring is one of the best ways to promote and market your company. It's one of the best ways to be able to make you stand out from the rest. And if you create a conjunction program of a telehealth SaaS CHF COPD program, this distinguishingly will be able to get you out of the market and help you get more referrals. By adding a CHF COPD telehealth program, what you're doing is you're requiring patients' weight to be tracked on a daily basis and give nurses a 12-step process on how to be able to follow up, especially if it rises or decreases. It also includes a set of physician standing orders to which the nurse is authorized to be able to increase the patient's medications, change any certain drugs, provide additional services and visits, or you're going to be able to start an IV medication. Now, of course, you need to be able to make sure you talk to your referral sources, the physicians. Do they agree to have a standing order ready to go, or do they still want to be monitored in a continual basis? This is something you're going to have to be able to speak to them about. By bringing in the physicians and asking for their input into these services, you can ultimately and be able to get them interested even more. Why? Because you're including them in the plan of care. You're including them in the plan of care of their patients. So look, now, having standing orders are great, but honestly, any changes should always be called to the physician. It's just a recommendation that was made by a couple telehealth companies out there. But in all due reality, any orders that you actually make, any orders that you change, you should always call the physician for it. It's going to be a lot safer for you, and that's what the procedures are anyways. So look, the telehealth program always works, and that's why we made several videos in this training series to be able to talk about telehealth and how it can actually help you, especially how to be able to get more clients, especially the CHF and the COPD clients. That's going to be able to be very good clients for your company.